So we're going to do a class today that is all about self-care. I had a pretty rough day. I went to the ER for some abdominal pain. So my body feels very stiff, stuck together, almost kind of like curled in the fetal position because that's how I've been lying all day. And with pain, all my muscles have been really tensed up, so I can feel like my whole back, kind of just glued, and my knees are a little, I'm not sure, they kind of just feel tender underneath and on top. My hamstrings feel really weak, and my thighs also feel like glued together, like my quadricep is like, just feels like one giant thing. I'm also having a lot of anxiety, kind of feels right here. Excuse me. They put me on some pain medication, and I've been on it for about a week, and so it totally throws off my depression, anxiety. So right now I'm trying to calm myself down because today was very stressful and very long. So even though I'm completely exhausted, I can't go take a nap right now because I'm very wired and trying to process and thinking, what does this mean for my treatment? What do I have to change today? What do I need to make sure I do tomorrow? Do I have all my paperwork? How much did that cost for my insurance? Am I going to be able to pay my copay? The list goes on. We don't really get a break. Even though we're sick, we went to the hospital and we came home. There's still lots of stuff to do. So this is where this comes in. So first we're just going to start simple with breath. I'm sitting in a nice cross-legged seat. If that's not comfortable for you, you can keep your legs long. You can lay down if you want to. And you can be on a bed, a couch. This is going to be not very physically taxing because there's no way. Alright, so just going to take a nice inhale. And a full exhale. Inhaling, you can feel your chest rise. Exhale. Let go, let your shoulders lower. Notice what's running through your mind right now. That stream of conscious talking. So see if you can kind of slow down maybe what they're saying or their words and just kind of let it drift by you without getting too caught up in the chatter of it. And sometimes just focusing on the breath completely, and that makes space in my mind at least. So I can feel a lot of tightness in my chest, and I'm assuming it's because I've been a lot like this. So I want to do a little bit to open up my chest and my lungs. So on mine, you can put your feet on. If you like to have your knees bent, you can. If you want to have your legs long, or you can do cross feet. But I'm going to just, this helps me get a little bit more length in my spine. And I feel a little bit more secure with my feet on the ground because I'm really dizzy. So this feels good. But see what kind of helps you stay grounded and centered in your seat and your torso. And then we're just going to roll our shoulders. back and forth in really big circles. Just saying hello to the whole joint. So I'm going to gently tilt my head from side to side. I can feel things kind of pulling up and down on my neck, down to my shoulders. And if you want, you can trace it with your hands. So you might feel like a certain spot on either side. So I move here and I feel it right here. So you can press your body and feel it kind of, oh, it's tight, it's hard. Like that feels uncomfortable. And then kind of just use your fingers as like little detectives and see if you can draw a line maybe up of where this muscle is connecting to, what part of your body, and it connects right to the base of my skull. So I can try and like work on just doing little like massages, 2 or 3 fingers, pressing at the base of my skull, just moving like in a circle other way. And then I'm going to kind of keep going down the base along my hairline and just gently giving yourself a massage while letting yourself also release in the neck. And don't forget to breathe, because I am, and because I'm trying to concentrate and it's making me really dizzy. So make sure you're breathing. The next thing I really like to do is to kind of grab this area. It's like my trapeze. What I like to do next is kind of grab my trapezius muscle on either side of my neck with my thumb and kind of like lift it up. And then just start to work my fingers on my back, going like up and down alongside the spine, like never touching the hard vertebra of the spine, but just rubbing like alongside of it as if there are muscles, very long muscles running alongside the spine. They're kind of underneath your trap muscle. So you can sometimes feel them, they're like longer, a little like rope, I kind of think. So when my back feels completely stuck together, I think of where they start, which is at the base of my skull, and then they end all different kinds of places, but down your back for each specific muscle. And you kind of think about the sacrum is where the back muscles end. So, yeah, you can even, I normally start with my shoulders, and see, I can't really get into the middle of it, but I also like to just kind of feel with I ball my hands up and just kind of feel how my back's doing, and I go in a downward motion. And you can kind of also do that little finger massage all the way down your spine, but never touching the spine, just the muscles along it. And make sure you're breathing. And so I feel 2 big spasms kind of right here. I know, and they're connected to all the tissue and muscle going down, but also going up. So when you feel a little knot, it's not just that one tiny thing, it's the whole place around it. So spend some time just kind of like softly opening up different kinds of tissue. So with the bolster, I'm going to turn it on its side and have it up. Feet again nice and kind of relaxed. And then I'm going to walk my hands kind of towards the end of it. I'm comfortable with laying my head down on the bolster, but if you need extra props, you can get a block. You can get a little blanket, roll it up, put it underneath your head. And the palms are going to come up, but we're just going to drop them down onto the thighs, the shins, or the ground. Whatever feels most comfortable for you. I'm going to stay in this position for a couple minutes. Find your breath, and So we're going to just breathe and stay really soft. My body's initial reaction is to close off, come out of the pose. This is uncomfortable. I don't like it. Get me out. But if you're using your breath, you can stay there for a couple minutes and calm your body into the sympathetic nervous system, which is where we can relax and release muscles. So the breath is really important. This is a passive pose. In more of a yin yoga style, which I really like to practice. So you keep resting. I'm going to take a little bit of a break. If you need to come up and take a break, go ahead. If you want to go back down, now's the time. Just rest. Let the shoulders open. And just imagine your whole back uncurling, unwinding. The base of your neck is lengthening. My hamstrings are starting to get soft, and that instant kind of panic of, oh, this pose, I don't like it, it's uncomfortable, look, I have to get out of it, it's gone. And now I can kind of enjoy the stretch. It's starting to get into my lower back. I can feel it in the front of my hips. And with each breath, you should be able to go a little bit deeper. We're only going to be here for a couple more seconds. So see if you can deepen the breath and open up just a little bit more where you feel tightness or discomfort. And then slowly palms come to face down. Walk the palms back towards the hips. Head comes up very slowly. Last, I kind of feel like I need my hands to do it.